Good afternoon, everybody, and welcome to today's webinar on the GE Healthy Cities Leadership Challenge brought to you by NineSigma. My name is Casey Shapiro, and I will be your host and moderator for this webinar. Please note that this webinar is being recorded and will be transcribed for viewing on the challenge website at a later date. So now let's briefly go through the agenda. Here we go. First, we're going to go ahead and provide you some speaker introductions. Then we'll provide an overview of the challenge. And then after that, we'll present some frequently asked questions. All right, a second. There we go, technical difficulties. I apologize for that. And then we will present, like I said, the frequently asked questions of the challenge, and then we'll work through the live audience Q&A. To participate in that live Q&A, go ahead and submit your questions at any time through the Q&A chat box. We're going to collect and present all of these questions during that live section. If we don't answer your question live, please note that we'll be transcribing and answering all questions asked during the session and then posting them on the challenge forum at a later date. Finally, we'll wrap up with the information on what you can do today for the challenge, including where to register, how to stay connected, and how to submit your proposal. Additionally, during this webinar, we invite you to live tweet any and all of the facts that we might share. You can use the hashtag HealthyCities, and then you can tag any or both of the following handles at General Electric and at NineSigma, which are below at the bottom of all of these slides. So now I'm pleased to welcome all of the speakers today to our webinar. From GE, we have Alan Gilbert, Director, Healthy Policy, Governance, and Community Strategy, GE Health Imagination. Steve Domek, Process Impact Leader, GE Genius Link. And while Michelle will not be speaking today, she was integral in the design of this challenge, so we want to go ahead and give thanks to her. It's Michelle Zambretti, Manager, Community Health Programs, GE Health Imagination. And then from NineSigma, we have Paul Masili, Program Manager. So now I'm going to go ahead and turn it over to Alan to give us an overview of this challenge. Alan, go on ahead.
Great, thanks a lot. I hope everyone can hear me. Welcome welcome to the webinar, and thanks everyone for joining. It is a great kind of rainy day here. I'm actually sitting in Washington, D.C., and am pleased to talk about GE's Healthy Cities Leadership Academy. As I have thought about this program over the last couple of years, and I will kind of describe to you how we came to building this national effort and trying to work on population health, I've really began to think about it in a couple of really key buckets. And I really began to think about it many years ago when we started our efforts in some of the cities for which we have large employees and families. And we found in those communities that we needed to work lots of stuff inside our Friends to Work on. Benefits for our employees. We have health and wellness programs for our employees. GE, if you are not familiar, is a large multinational corporation, I guess one of the large multinational companies in the world. We have about 400,000 employees worldwide, but about 500,000 either employees, families, or retirees in America alone. And so we really do try to work in the communities in which we serve in a very holistic and very passionate way to add to those communities. And I really began to believe that what we were doing in GE was very different than what other businesses across the country were doing, and really began to see a lot of the need that's out there to work and bring together collaborations and partnerships that really try to target population health, and not just sort of health care. I've always said health and health care are two different things in my life. So really this effort is to build a foundation for this national, sort of what I consider a national effort. I want to take each and every one of you and build you into an army of leaders to really spread and scale the efforts that we're trying to accomplish here. If you go to the next slide, I just kind of want to tell you a little bit about the vision for the program. We really have thought about this in a very holistic way, and the goal of this program really is to inspire and develop leaders to scale population health. I mean, we see cities as one of the last, and communities for which you're sitting in, as one of the last sort of bastions of functioning government, and we think that there's so much work going on in these communities and so many works that are in silos in some ways. And if there were a way to connect the dots and set a leading example and then really engage those communities and engage the leaders that are you in those communities to grow new healthy communities, that we really can incite this transformation. We want to bring together some of the most passionate and leading experts across the nation that have been thinking about population health for many, many years and have been thinking about health and healthcare delivery for many, many years. GE sits on a panel, a population health roundtable that's created by the National Academy of Medicine and the National Academy of Sciences, and some of the leading experts across the nation have really been thinking about this effort and how business needs to engage. So we really feel strongly about this as a vision to embrace the innovations and learnings that are going on in so many different places across the country and sort of push that out to communities, not only where we have populations, but also in other communities across the country. If you go to the next slide, I wanted to start a little bit by giving just some baseline of sort of how we got started in GE. I mentioned our 400,000 employees, the 500,000 in the U.S. alone. We have everything from choo-choo trains in Erie, Pennsylvania. We make jet engines in Cincinnati, Ohio. We obviously make light bulbs, you know that. We also make big expensive healthcare technology devices for health hospitals as our largest customers. We have a large and very large and growing business around oil and gas and power and water. And so we really do cover the gamut. And in those communities in which we serve, we have big presence. Cincinnati, Ohio, for example, where it all started, we have about 50,000 employees and family members and retirees that live in that community, about 7,000 employees, and a big fenced facility that builds jet engines right outside of Cincinnati. And so in 2009, we began to think about what we needed to do to work in that community to bring down, not only bring down healthcare costs, but improve quality in that community. If I looked at Cincinnati, Ohio back in 2009, I would have seen from my benefits perspective that it was one of the highest incidences of chronic disease for any of our populations in the country, and we were spending a disproportionate number of dollars on those employees. And we really wanted to sort of work on those issues. We started out thinking, well, if we can just get our own house in order and bring a robust health and wellness program together, not just for Cincinnati, but for the country, for our employees across the country, if we can improve our benefits and quality, we'll be able to bring down those indicators. But we really were not able to do that, and we realized, I think, early on that we had to work outside of our fence, and we needed to band together with other employers in the community. We were sitting in a community that had this incredible spirit and culture, and some of Cincinnati may be on the line, and so they know this. We were sitting in a community that had been working on health and healthcare for a long time, and there was this sort of culture of cooperation, sort of secret sauce in the community that was really working. And so we band together with Procter & Gamble, also a large employer in that community, Fifth Third, a large bank in the country that's based there, and other companies based there, and with the public health department, with the mayor's office, with a lot of the community stakeholders, with the hospital systems and others, and really worked on a program to sort of start trying to change that dynamic. And we've been at it in Cincinnati for about 5 years, and I would say here that since we've worked on it, we have succeeded in really sort of bringing better health, better care, and lower costs to that communities. And we've measured our employees, and so has Procter & Gamble and others, and we drove really what I would say is clinical care excellence in that community. One of the things that we learned, however, was that this piece of health and healthcare that we were working on was really seriously just one piece. If you go to the next slide, I think it's really important to understand that we quickly learned in Cincinnati that we needed to work on the larger determinants of health. That even if we did the best health and wellness program we can, and GE spends about $50 million a year on a health and wellness program, not just in America, but across the globe. And we have incredible, sort of, if you want to think of it almost as bullets in a gun, we have incredible efforts that we can undertake as far as benefits are concerned. We can bundle payments. We can create centers of excellence for orthopedics and maternity care, and we've done all those things, but we still could not improve care and the health of that community the way we wanted. And I think one of our earliest learnings was that we needed to attack these other broader determinants of health. And this is a chart of the sort of determinants of health created by the Robert Wood Johnson Foundation, who's a partner in this program, along with the University of Wisconsin and a man named Dr. David Kindig, who's, I believe, sort of the godfather of social determinants of health. And if you see here on the right, you'll see all these lists of secondary determinants, and you have to really, we've kind of come to believe you have to really work on all of those determinants to be able to do that, to be able to make an impact and really improve health overall in your community. So when we expanded our program beyond Cincinnati to places like Erie, Pennsylvania, where we make choo-choo trains, and Louisville, Kentucky, where we make appliances, and then most recently in Houston, Texas, where we have a very large, actually now our largest global footprint is in Houston, Texas, oil and gas, power and water. We really began to embrace this broader determinants of health strategy and brought in partners, and for example, in Houston with the mayor of Houston, Texas, and the public health department, all the city leaders, and everyone from public safety to the environmental groups in that community to philanthropic efforts. We now really have a program in Houston that I believe is really going to attack these broader health determinants. And we're working to not only improve care and lower cost in that community with the hospital systems, building a sort of, I think, first-in-kind kind of health IT system in the community, but we're also working on public safety and environment and the built environment in that community. And I think those are the ways that we have come to believe we really need to tackle it. I will say that, some might ask already, the first question that might come out is like, why does GE believe they can work on public safety, or just looking across the, education? Early childhood education is a huge determinant of health in anybody's community, of those of you who know anything about this on the phone call. Well, I believe there really is a case for business being involved in this. And if you go to the next slide, you'll see that I've sort of really tried to capture this for those for this community. And as a large employer, we too sort of struggled with, what's the ROI for this? And there really is, I think, a broad ROI. And with the help of the Population Health Roundtable at the Institute of Medicine, they're actually pushing out a sort of this business case for businesses in your community to be involved. And of course, there's lower health spend for employees and their families, but there's also, I think Cincinnati would probably be one of the first communities to tell you that the work that we've been doing over the years to improve that community's health and health care is like a vibrant, jobs creator for the community. I mean, if I'm GE and want to decide if I'm moving into your community, I look at a lot of these things, like we did when we changed our global headquarters just recently to Boston from Connecticut. We really, but there's these broad determinants, I think, as a business that really build your community, that are sort of imperative for businesses to engage in. I mean, my chairman, Jeff Immelt, believes that it is an economic imperative that we embrace these broader determinants of health. And I think in some ways, this effort is to try to address and bring these kind of core issues to business, and make the case for them. I mean, this program at its very core, and I will turn it over to some colleague to sort of go through some of the specifics of how you apply and what are the requirements. But at its very essence, this program is to try to connect those dots between business and, say, the public health community and the other parts of the community that they may not otherwise be working with. I mean, so many times what we've seen, and we did a lot of research before launching this program, was that lots of businesses and communities are working and doing incredible things, but what's missing sometimes at the table is that sort of business, the business at the table. And it's not because businesses many times don't want to. They may not know how to connect those dots. They may not know those folks in the community. So if we can, through this program, sort of develop a model in some ways and able to leverage sort of the size and scale and diversity that we'll see in these communities, I think we'll be able to sort of really kind of blow out this effort and develop that army of leaders that I talked about at the very beginning. And I hope that every one of you apply. I mean, for up to 10 of you, I think we'll be able to not only provide resources and give you the eligibility to at the end of a year of training and teaching and collaborative learning, which I'll be happy to talk more about at the end of this presentation. I really believe that we're going to find incredible communities out there doing incredible things. You know, frankly, we're agnostic on whether, back to that determinants of health model, whether you come to us and say you want to work on, you know, early childhood education in your community, or tobacco cessation, or community safety. It's really the model of teaching you how to work together and how to make progress and nurture that. And we really will have a SWAT team of leading experts around the nation that we have access to help you do that. So it's very exciting. The very first slide that I showed was our Crotonville Learning Center. GE has almost a college campus sitting upstate New York, above New York City. And we're really excited to bring the 10 winning communities together to really sort of kick this off in the fall, in the middle of October. And I'm just really excited to be a part of this, to have been a little part of the vision for this, and look forward to your questions. Thank you very much.
Thank you so much, Alan. So we, I believe we might have, unfortunately not, I think you talked through the actual slides, but we did not go through them. Is this correct? So I apologize for that. These will be up for on the recording, so no worries about that. But I'm going to go ahead and turn it over to Paul Musili here at NineSigma and ask him why solution providers should be interested in this challenge.
Great, thanks Casey. And just a reminder before I get started, if you have any questions sort of about the overall vision of the challenge, or the actual aspects of applying, or the criteria for winning, if you have any questions about that, feel free to put those into the question box, and we'll go ahead and get started curating those to ask to the GE team later during our live Q&A session. So feel free to ask those anytime. We're waiting and ready for that.
Great. So,
yeah. Thanks, Casey.
No problem.
So I'm going to talk a little bit about why solution providers should be interested in the challenge, and I'm going to start first with sort of wrapping up a little bit of what Alan said with just a real quick overall description of the goals of the challenge. So as Alan mentioned, there's sort of two really key aspects to this challenge. The first being that GE is trying to incentivize people to help improve their local or dispersed population, to improve their health or lower their healthcare costs, really focusing on the full health and wellness of a community of choice that they're trying to target. And to help with that goal, GE thinks that adding a business perspective is a really important way to further these goals of providing health and wellness for communities. So when you're crafting your response, it's going to be really important that you both talk about the community that you're trying to target, what difference you're trying to make in that community, and how bringing in a business will help you achieve the goals that you're setting out to achieve. And along with those points, I'm going to talk a little bit about the evaluation criteria that the GE team will use to judge the proposals that are received. So important to note is that a panel of at least 4 judges with expertise in the field of population health will be evaluating the plan. So there will be expert opinions attached to the judging and evaluation of the proposals. We've laid out here the criteria that the judges will use to help them judge the proposals as they come in. I won't read these all off to you right now. They're listed here. As Casey said, we'll make these slides available after the presentation. And additionally, all of this information is also available on the challenge website, which we have links provided to as well. So you can either consume that information here or on the website that we've built that outlines all of these details as well. But sort of the overall criteria is who are you targeting? What kind of difference are you trying to make? What business are you partnering with to help further that, further those goals? And then if you were to win, how would you use any money to help make those differences that you're trying to enact in these communities? I spoke a little bit about money. So the reward for winning, so there will be up to 10 teams chosen as winners. And each of those teams will receive a couple of different things, some of which Alan touched on. So the first will be up to $25,000 in funds during the first round, which will be available for teams to use to help further their efforts to make the changes that they're aspiring to in these communities. In addition to the money, GE has also done a spectacular job setting up a year-long program of mentorship and partnership with experts in the field of population health, business, and public health. And this is going to form the basis of a learning collaborative which will help the teams who have been picked as winners to help actually make real and actionable change in their communities with the backing of this program. In addition, after the first round, or about a year, the team selected will submit some reporting about the work that they've done in their communities and will be eligible to receive some portion of an additional prize pool of up to $250,000 to further develop and implement their team's plan for an additional period of time starting in 2018. So the potential for a substantial amount of money, some backing by experts and mentorship from a really great and vibrant team, and as well as the ability to get started with up to a 2-year program. There are some conditions listed at the bottom of the slide for the round 1 funds, but most of that is just being an engaged part of your plan and enacting that plan. Again, won't read through these in detail, but available both here on the webinar and on the website. As far as the timeline goes, so we've launched the challenge, been live for about a month now, so we launched back in May. The submission deadline is July 27th, 5 p.m. Eastern Time, so still a good bit of time to start building your teams, putting together the different components that you'll need to apply, and sort of getting confirmation of all the parties involved that you might be able to work together on a 2-year plan to enact change in your community. And from the time after July 27th, GE will have that judging panel looking through the proposals and deciding which 10 will be selected as winners, and we'll announce those finalists in mid-October.
Great. Thank you so much, Paul. So now we're just going to go ahead and go through some frequently asked questions. These have been fielded from the NineSigma Provider Help Desk and the Challenge Forum. So the first question is, what is the plan to provide mentors to the teams?
And I think you're probably looking to me to answer that, correct? This is Alan Gilbert again from GE.
Yes.
Yeah, I'm glad someone asked that question as sort of the leading first question, because you just finished hearing our colleague from NineSigma talk about the mentorship and the opportunities to work with experts in the field, and I think that's really important. I think that so much of this work is about peer support, and have, with my work in the last several years in this space, my participation and my colleagues' participation in the Population Health Roundtable, what we've seen is a real need for that kind of peer support and effort. And we're certainly not, by any means, trying to sort of impose our, our views in some sense on what you're already doing and the incredible things that are going on in those communities. In fact, in the communities for which GE is working and that I help lead in places like Houston and Erie and Cincinnati, the work that is going on is incredible, and so our efforts are always additive in some ways to the work that's happening. But the mentorship and the opportunity is going to be really, I think, is going to be really exciting and additive to the work that you're already doing in your community. For example, I know that there's a requirement of being able to participate in sort of virtual training sessions. We're going to have some of the best academics in the country on population health improvement, basically teaching in different and various settings. So, you know, one month it might be a webinar for which everyone that is a participant, and in fact, we don't want to open this up for folks that are not winners, so that they're almost in kind of a virtual tourism way, is the way RWJ describes this to me in a past conversation, can participate in these as well, because what we all know is that when you come together, build your team and apply for, whether it's a grant proposal you might be applying from RWJ, or this program from GE, or a program that might be funded through you know, HHS or a state or local group, more times than not, you're very passionate about this work. And when you maybe don't win this round, you actually try to do the work anyway. And we hear that time and time again with all of our partnerships and collaborations in this space. And so we want to make those kind of things available to everyone. If you're lucky to be one of those selected, you'll win resources from us, but we'd love to have that broader community to come together. I personally believe that what's going to be the most exciting part of this mentorship is going to be from your other folks in this program. That's why we want to bring people together in early October, announce all the winners, get all of you together to be able to really sort of begin to collaborate and learn together. There's this effort in many places of the country where you can take sort of low-performing programs and then pair them with a higher performing, and then each learn something incredible. So, you know, we're going to be SWAT team-like around these programs, nurturing them. We may have other opportunities to attend seminars in another location, bring together again, and then more importantly, or as important, is around the midway point of this year. So think this time next year, these groups and these academic experts from across the country, so the David Kendig that wrote the book on population health improvement, Don Berwick, who is an advisor of ours, who's a former official, a U.S. government official in the Obama administration, who led the Centers for Medicare and Medicaid Services as one of the advisors. They will be your personal mentors through this journey, but we're also going to have them come to site visits where myself and some of our partners will come to your community and help you sort of roll up our sleeves and work on what progress you're having, what stumbling blocks you have. We also want to teach leadership for leadership's sake. So the reason it's also important to have everyone come to our Crotonville Learning Center is that's what we teach there. For the 400,000 employees that work at GE that we invest in as employees, we try to teach leadership so that when they become managers, executives, they actually have the skills they need to manage, whether it's 2 people or 2,000. And so we have incredible experts at that facility, and we want to teach them. I'll give you an example. After 9/11, the city of New York came to us, and we asked, what can we do to help? And they wanted us to help teach an entire new generation of leaders in the New York Fire Department, because all of their managers were, frankly, killed in 9/11, or most of them. So we continue to this day, you know, over 10 years later, teaching leadership to the fire department in New York City. And so that's the kind of things and the kind of programs that we want to provide to not just from GE, but from all these experts around the country in population health for this year of mentorship.
Great, thank you so much, Alan. And then number 2 is, how do you define a community?
Yeah, that's a great question, right? So everybody probably on the line says, well, I was sitting in a community, right? I think that's in, you know, I'm sitting in Des Moines, Iowa. That's a community. But I think, you know, if I were sitting in a community, or if I were sitting in GE, because I would really hope that on this line are some folks from business, I hope. So raise your hand if you are. But if I were sitting in my company, I might actually think of a creative way to think of a community, and I really mean that for all of you. I might think, well, my should knock on the door of some other employers in my community and think about all the, I'll just make this up, but think about all the, you know, my diabetic population and my other brothers in other businesses, and that could be a community, and you could create a program and propose an idea around that community. Don't even think within your borders. It could be a couple of communities banding together to work on an issue. That could be a community. So don't think of it just in maybe like look it up on Wikipedia and that defines a community. Think more broadly, because I actually think that's the greatest thing about open innovation that NineSigma promotes, is that you can really think outside the box of what some of these mean and get really exciting ideas. I hope to get some really exciting program proposals in, and so you know, community might be just Des Moines, but it also might mean something else, and I look forward to that. And we've allowed for that in the terms and conditions. So bring us your best ideas.
Great. And then this last frequently asked question, Alan, was how do you define a business?
Yeah, also a very good question. Of course, the official rules and the official rules have a definition of a business, and I would suggest to you know, that in the competition, it's first of all it's all to U.S.-based companies. I mean U.S.-based coalition community coalitions that include one validly formed corporate partner. And so I guess what I would say, Katie, is you know, the focus of this entire program is around sort of connecting those dots between the business community and, let's say, the other communities or the other groups within a community or communities that are working on these broader issues, whether it be public safety or it be healthcare delivery or it be, you know, tobacco cessation or something else. And so it's really important, I'll just say that again, it's really important that when you submit your proposal, you have a business at that table. That's the you know, I think that's the cornerstone of this program. What can that business look like? Not every community has a business like GE sitting in it, of course, but you know your community, you know your business, you know your businesses in your community, you know who's sitting in your chamber of commerce, you know, groups in those teams, and so I think that's important. It can be a hospital system. I will put that out there because I know that's probably been a question as well. In many communities, your largest employers in small towns across the country is either the school system, and it can't be that because the school system's not a corporate entity that hasn't declared bankruptcy. Well, I don't know about the bankruptcy part, but definitely hasn't is not a business. But your hospital system is in many ways. I mean, usually is one of the largest employers. So I just throw that out there.
Great, thank you so much. So now we're going to go ahead and move into the live Q&A portion. At this time, go ahead and continue to submit those questions into the Q&A chat box. We've already received a number in, so thank you very much for that. We're going to go ahead and take the rest of this time to answer those questions live. If we don't get to your question live, don't worry. As we stated multiple times, this is being recorded and all of the questions and answers are going to be made available on the challenge site following the webinar along with the recording. So I'm going to go ahead and go to a slide just so you know who all you're going to hear from. Paul from NineSigma will be moderating all of the questions. So.
Great, thanks Casey. As she said, we have a number of questions coming in, so we're going to get through just as many of those as we can. So go ahead and put your questions into the box if you haven't already, and we'll do our best to get to them. So one of the first questions that I see is about websites. So to learn more from the NineSigma side, you can visit HealthyCitiesLeadership.com, and that will give you all of the challenge details. As Alan mentioned, there's the terms and conditions for the challenge. That is there. We have the full details of how to participate, how to respond, all the rules and all of the criteria, information about the judging panel. But I think the question was sort of two parts. So that's where you find all of the NineSigma and contest information. But Alan, if someone were to want to learn more about GE and their history of helping in the health and wellness area, is there a GE website you might be able to point them to in order to brush up on what GE's done in the past?
Absolutely. So I would encourage you to go just to the go to ge.com. Pretty easy, right? But also when you get there, look for, I believe at the bottom of the main page is a link to GE Healthy Imagination, and I can even spell that for you because it's kind of a tongue twister. But it's like imagination. Our brand used to be Imagination at Work, but it's healthy with imagination without the I. So it's a healthy imagination. And you'll see there a lot of the work that Healthy Imagination has done over the years. For example, the work in Cincinnati. You'll see the work in other communities that we've done. So that'll help you get a better sense of the kinds of things that we have done in those communities for which we have a large presence. It'll also give you a sense for the scope and scale of our company and all the areas that we work in. I think it's important to understand that because we see so much in a city. Most communities, everything from the backup generators in your hospitals when the power goes down to the actual generator that's running your city grid is many times to the lights on the light posts in your city are GE products. To everything that to the microwave that sits in my house, right? Which I better have a GE appliance in my house. And so I think it gives you a broad scope of our sort of commercial presence in many communities across the country. But I also think it's important on the website is to understand one other thing, Paul, which is, we see healthyleadership.com, HealthyCitiesLeadership.com as a living, breathing kind of organism. So when the challenge is concluded, that will become a broader source of information and really a place for learning and collaboration, not only for the teams that win, but for others. And so I think that's important to know that we will provide that support along the way in in the fall and in 2017 and beyond.
Great, thanks, Alan. This next question came in early, so it was before you talked a little bit about the community aspect of the challenge, but I think it's worth sort of reiterating anyway. So the question asks, states first that many of the examples cited are from larger metropolitan areas and areas where GE has some presence. So the question is, do you have to be talking about a community that is metropolitan or is in a space where GE has employees, or is it okay to be a rural area or some other type of community?
That's a great question, and I think I've been involved in other programs like this, not on population health, and when we were working in a neurology space, and everyone believed that the programs that we were selecting had to be in cities for which GE are in actually facilities that had GE equipment, and the answer could not be further from the truth. So I think it's actually really important that of these 10 communities, we have an interesting mix of size, shape, smell, etc. Right? So I really want to see a small rural community and then a large metropolitan community. A community that's defined outside the box, as I described earlier, would be exciting. So it doesn't have to have, for 500,000 employees and retirees in America alone, you can hardly find any place in America that doesn't have some GE, some connection, right? We have lots of facilities in many states across the country, but that does not matter to me. I want to see the best proposals and the most creative and exciting proposals come in without regard to whether you're sitting in Cincinnati, Ohio, where I have a big presence, or someplace in North Carolina that I do not have any. So I really think that's a critical question. So I'm glad you asked it again, so I could emphasize it. Someone might also ask, like, an incorporated city, right? And I think we don't think that that's absolutely essential either, right? I mean, to the same point that I said, come up with a community defined as you think, and we'll give it a fair judge. You mentioned earlier, Paul, we have 5 plus judges that are some of the nation's experts in this space. So, we're going to take a critical eye. It's going to be independently examined, and the winners selected from that. So I'm confident that these incredible folks that have given of their time are going to be able to pick some of the best programs without regard to size and shape.
Great, thanks for that. I have a couple of questions that are all sort of touching on the same topic, so I'm going to do my best to combine those into one unified question. And it all has to do with the definition of how the teams are built and the role and definition of what a company or corporation is as part of that team. So a couple of people are asking, is it okay if the business is a 501c3? Is it okay to define a church or another type of nonprofit as the business? What's the scenario, for example, if a hospital happens to be a 501c3? Could you just talk a little bit, Alan, about putting together that team and sort of how the company or corporation is defined as part of that larger team with other team members like a nonprofit?
Yeah, so I think I think this is this is a question for which we spend a great deal of time thinking about, and I'm glad that they're asking these questions. So we're thinking of a business in the same vein of a business that you would otherwise consider, right? So if you're a church is organized for legal reasons into a nonprofit, that really doesn't meet the definition that we're thinking. Just as if you could say the actual collaborative, right? If you have Greater, Greater Des Moines, I hope somebody's on Des Moines, I'm not picking on them, but Greater Dubuque, a healthy Greater Dubuque, that's organized into a collaborative, but that's not going to meet the definition. Remember, if you go back to the rules and you look at the very vision and view for which we're looking, right? We're looking to connect businesses to these broader determinants of health programs, right? So it's not think Walmart, not not the local community health center that's also organized as a nonprofit organization. I think that answers your question. We included hospitals specifically because we believe they are some of the largest employers in a community. So they have to wear multiple hats.
Great, thank you for that. Here's one I can answer myself. So the question is, will we be giving notice to the winners before the event that's held in October? And the answer to that is most definitely. We won't just spring that on you. We'll be letting the winners know in advance so that they have time to prep for that event and do some paperwork and make sure that everything's good with the proposal. So we'll definitely be giving notice to all of the teams who are prospective winners before that announcement. So that is great.
Yeah, and Paul, I would just add to that is absolutely, we want you to be able to celebrate that you're a winner in your local community, and having been in part of these kind of programs in the past, it's usually critical once you win that you want to celebrate it and tell everybody about it in some ways. And so what we want to make sure we do is coordinate so that you get the best press or the best bang for your buck, so to speak, out of it as well. So and as well, we'll be, as a requirement for winning, you need to be able to come to this a kickoff event, if you will, in October at our Crotonville Learning Center. And so we'll need to make sure we give you advance time to make arrangements for that. So as soon as we know, and I think that'll take, as Paul has mentioned, the challenge closes July 27th, and that is a hard deadline, if you haven't said that already, Paul. We'll spend a great deal of time going through these with the judges. It's August. I think we will. I can't promise anything, but I think it'll take us a while to go through these. I mean, I hope I get a ton of proposals, and so that'll take longer, right? To go through them to make sure that we get the very best ideas and programs as winners. So that selection process is going to take as long as we need to make sure that we get the best winners. So, but you definitely will know ahead of time.
Great, thanks for that addition, Alan. since we're starting to come up on time and I see a couple more questions that group together, I'm going to go ahead and join a couple more questions together. It's about the business case, Alan. So questions about people being interested in the topic and the challenge and trying to get their employer involved in that actual business case. Is there any information available about that business case or any data around that people might be able to use to help sort of convince their employer that this is something that's worthwhile to get involved with?
Yeah, there actually is, and I guess on the fly I can suggest something, and then maybe you guys will tell me if it will work or not. Which is, so as I mentioned earlier, I am a member of the National Academies of Medicine, which is part of the National Academy of Sciences here in the United States, and they have produced a pretty good well of recent information around the business case for participating in population health. What I might suggest, as well as GE has produced a white paper around our efforts in Cincinnati a couple years ago, so it's a little old, but we have it. If it is possible, because I certainly can't send it to everybody, but if it's possible, I might, we sometimes, Paul and Katie, have sort of, frequently asked Q&As posted on this website for those. I might be able to provide that information, clickable, if you will, for you guys, and they could download that background information for purposes of getting their employers involved, because that is really a critical part of this program.
Yeah, absolutely. If nowhere else, we'll definitely be able to provide links to that sort of information on the community forum, or we might even dedicate a space in the page for that info. So be on the lookout for that on the website to come. So here's an interesting question, sort of looking out into the future, Alan. At the end of round one, what are the sorts of things that you'll be looking for in that first year to judge success and to identify whether people are eligible for winning a second round of funding to help with additional time for implementation?
A very good question, and the criteria is listed in the official rules for being selected. I think the same criteria will be just as valuable for the during the year process. I mean, we're really looking for progress. I like to say it's progress, not perfection. In past challenges like this that I've led and participated in, that included like hard science around neurology. It was that had actual patients going through protocols. We certainly weren't looking for the outcomes we sought. Were not the cure, so to speak, but we were looking to see who made the most progress, who were successful based on those original metrics and milestones that were set out. And so that's what I would say. Look, I really am excited about this program and think that those of you who are selected will become the mentors and the teachers for the next program, for the next year, because I really see this as a program that hopefully GE, and I will say, like, just since launching, I have a lot of companies besides that look like me that are really interested in being part of this program beyond, say, this first pilot, if you will. I like to call things like this a pilot. And I think that we're going to have incredible successes and be able to teach this in 2018 and beyond. And this class of 2017, I believe, are going to be the mentors and the teachers and the success stories that we really want to amplify and collect and spread for this next class. And so I'm really looking for the progress against those original goals during that year period. As I said, we're going to try to give you every tool in your tool belt to succeed. And I want my job, or our job collectively, of these judges to be really difficult to make those final decisions. I will say it's a pot of $250,000 for which I hope to have a couple of winners from that we can really sort of lift up and show what incredible progress they've made. I hope that answers the question, Paul.
Yeah, great. Thank you. I think since we're coming up close to time here, we're going to ask just one more question and then start wrapping things up.
I hope it's a doozy.
No, it is a good one. There are some additional questions that have been coming in, and don't worry, we're not ignoring you. We'll compile those questions and write up some answers, NineSigma together with the GE team, and we'll make sure those are included in the materials that we send out as follow-up. So if your question didn't get addressed here, no worries. We'll make sure it gets addressed after the webinar. Sorry we couldn't get to it live, but we'll make sure to provide an answer for you. So Alan, the last doozy question I have for you. You talked about treating population health and the health model sort of overall, and a question came in wondering if it's okay to work on or address more than one area of the population health model.
My answer is like, why not? I mean, so I would suggest that a community, for a couple things. I would suggest a community could submit multiple proposals. So they might say, gosh, we can't pick between community safety and, I don't know, STD prevention. So submit two. Maybe we'll pick one of them. Or maybe we might pick both of them for you, and you'd really be excited, right? But you have to have a different team dedicated to that, right? So, I mean, I think it's important. I mean, someone asked the mentoring question earlier, and I think it's really important to see what is chosen because, for example, if you come in with a public safety proposal, I'm going to want to surround you with people that are experts in that field. If you come in with a proposal on STD prevention, maybe the public safety people work, but I'll probably try to get other people that will help you in that learning collaborative way. So I think that's critical. I do think that if you look at that social determinants of health model, which is kind of what we're asking the communities to look at for the purposes of choosing what program they want to propose, which is not anything new. I mean, this model is everything you guys in the community already know and are working on. I know these are the issues that are bubbling up in your community that need to be worked on, that are the broader health issues in your community, whether it be obesity or tobacco or community safety. And some of them naturally fit together. So I would say bring it on. I mean, if you want to bring together all of clinical care and say, I'm going to work on payment reform and delivery of care in a subpopulation and do all these things, I say more power to you. Understand what you're taking on, but I think that's exciting. So I would encourage the broadest kind of thinking around what you propose, who you propose it with, and what your community itself looks like.
Great, thanks, Alan. One more really quick because I think it's a really great one. Does it matter who is the actual submitting organization or person? Does it matter to you who is crafting and submitting that response from the team as a whole?
So I think we have rules around that, Paul, and you maybe actually on this level of detail may know more than I. I know that we described that we needed someone that was actually like, let's call it the program investigator or the PI, if you will, in some ways, that was submitting, because that's the person that I'm going to reach out to and say, congratulations, you won, Betty, or you won, Bob. So I have to have that person, and I think if I remember, Paul, and you checked me on this, it had to be someone in an entity that was able to, sort of sign off and be part of this and collectively have the, the authority from the community to do it. Does that make sense? I mean, you might want to put that Q&A up on the website as well with our frequently asked questions and others, because I know there was a specific, so Alan Gilbert sitting in his home in Washington, D.C. couldn't just submit it on his behalf. I needed to be Alan Gilbert sitting in, either one of the partners that's on the list on the team or from the greater collaborative that's part of the team, right? So that was the way it worked, I believe.
Yep. The other key aspect was being able to accept and utilize the money. So you're right on there.
Yes, exactly.
And just like many of the questions, some of these answers are, or many of the answers are in the terms and conditions or the rules document, which is on HealthyCitiesLeadership.com, which we will point you to a number of times. So thank you for that, Alan, and with that I'll turn it back to Casey to help us wrap up.
Yep. Thank you so much, Paul and Alan. So like Paul said, we are going to wrap up at this point, and we're going to do so by telling you what you can do today. As we've mentioned multiple times, please visit the HealthyCitiesLeadership.com website for all of this information and more. You can go ahead and stay connected via the community forum there, register to receive the updates, view FAQs, and join the community. This is also where that community forum is that we have been talking about, where all of this material is going to be available post-webinar. Build your team, obviously, so that you can go ahead and submit your proposal. If you need any help, ask the NineSigma Solution Provider Help Desk, which is email grandchallenge@ninesigma.com. And if you wanted to ask by phone, it's 216-283-3914. And then, of course, submit your proposal. As Alan said, it is a hard deadline of July 27th, 2016 at 5 p.m. Eastern Daylight Time. So just one last reminder that this webinar is being recorded and will be made available on that site, along with the transcript of the Q&A. We are going to thank you all for your attendance, and then thank the speakers, Alan and Paul, for their time and expertise. We appreciate everybody's time, and we look forward to receiving your submissions. Thank you so much.